It is.
Hey everyone, welcome to the South Australia webinar, and we'll just wait till all the participants populate. It's quite a well RSVP'd webinar for restaurant and catering. There are a lot of very interested South Australian members that want the latest news from South Australia. The numbers are just jumping up. In fact, I think we may hit our entire RSVP list. Thanks to Julia's hard work and getting everybody informed, I think we'll get pretty close to our RSVP. So it's 3:33. We usually give just a few minutes once we start the webinar for everyone to log in, and so the numbers just keep increasing. So we will just wait a moment longer before we get started. I'm waiting for a target number and we're almost there. All right. Okay, so I'm going to hand over to Julia to get things started.
Thank you, Wes. Good afternoon, everybody. I'm Julia Robinson. Most of you already know me, and I'm the Membership Executive in South Australia for the R&CA and Catering Association. And would like to welcome and thank you for participating and joining in today to listen and help us assist you explain with the upcoming changes given the South Australian borders are going to be opening tomorrow. Some of the topics today that we're going to have a little chat about are the mandating of vaccinations, leave entitlement during quarantine, and a clarification on the border reopening roadmap. But just a little bit of housekeeping first up is if you want to pop any of your questions into the question and answer box, it's down the bottom, second along, you can see it there. So just pop your questions in there. I'll be fielding them. So if you pop them into the Q&A box, not into the chat box, we'll just get a much better view of them all. Brendan will also be providing a very extensive information on the mandating of the COVID vaccine. So please hold your questions just till maybe Brendan has finished, because you'll find he probably will address it when he's having a chat to you. So first of all, I want to introduce everybody to you. Wes has already said hello, but Wes Lambert, CEO, Restaurant and Catering. Brendan Zhu, a little wave there, Brendan, Senior Advisor, Industrial Relations and Policy, and Hugo Robinson, Head of Policy, Government and Public Affairs. So now to start, Brendan will do the acknowledgement of the country, and then Wes will provide a brief overview of today's webinar. Thank you, Brendan.
Thank you, Julia. Yeah, before we begin, I'd just like to acknowledge the traditional owners of the land and where we all meet today, and pay my respects to the elders past, present, and of course those future, and in particular to those who may identify as Aboriginal or Torres Strait Islander who are present today on the webinar. Particularly want to acknowledge, of course, given that it's a SA-based event with the Adelaide team, the Kaurna people, and acknowledge their relationship with country as well. Thank you, Julia.
All right, so I'm ready to go. So we made it. It's 23rd November tomorrow, and the borders will be reopening. Certainly, that goes in line also with the Prime Minister making the announcement today on the international borders reopening for valid visa holders. He certainly did not give all of the news, and I spoke to the Immigration Minister, who called me moments after the Prime Minister finished to let me know that it's many different visa classes. It's not only international students and skilled migrants, but it is also, ready, drum roll, working holidaymakers. It's anyone with a valid visa that still is valid, or any visa that's applied for that's available. So yes, working holidaymakers will begin to return to Australia from 1 December. Now, there is only not quarantine-free travel. Excuse me, there is only quarantine-free travel in New South Wales, Victoria, and ACT at present. There still is and will be 7 days of quarantine for vaccinated international arrivals. So certainly there will be a bit of time for those international students, skilled migrants, and working holidaymakers. However, we do expect that as time goes on, that requirement will go away. Certainly, we know you're going to have a lot of questions about what is and isn't going to continue, and questions about mandatory vaccinations, which many states have chosen to make them mandatory in perpetuity. So, for example, in Victoria, Queensland, Northern Territory, and WA, there is no end date on mandatory vaccinations. There's also no end date on mandatory vaccinations for flights or to enter the airport, and some other federal or large corporation mandates that supersede the state non-mandating of vaccines. And also, I'm sure there's going to be lots of questions about when the borders might reopen totally for everyone, and also your fair work requirements. So without further ado, I will pass over to Hugo to continue the webinar.
Brendan.
Oh, is it Brendan first or Hugo? Brendan first, sorry.
They're both very
Not a
good.
problem. No, that's all right. Hi, everyone, and hello to all the SA members who, I've been able to speak to over the IR hotline, and of course, to be able to share a bit about the vaccine mandates for the hospitality industry. I think the first thing to point out, of course, is that in Australia and the approach towards the vaccine mandates, it is a state-by-state approach. And so what you may have heard in other states, although is a good, learning experience and a good indicator of the future moving forward, you always want to clarify what your particular state rules are at the moment. And I note that because in particular, and what is unique to SA, is that there are no public health orders that mandate vaccinations yet at the moment. And so what that means is that there are therefore implications on whether you can have mandatory vaccination in your workplace. If mandatory COVID-19 vaccination is something you want for your employees or patrons, there's a few things to think about. So first of all, I'll start with the patrons, just because that's low-hanging fruit and easier to deal with when compared to employees. As a establishment and as a business, you always have the ability to choose to refuse service or entry for your establishment, so long as they're not on certain discriminatory grounds, such as, for example, sexual orientation or race or disability. Now, if someone has a genuine medical exemption for the COVID-19 vaccination, that's something to think about as well, for patrons, that is. But other than that, if you wanted your particular establishment to be able to only service those with the COVID-19 vaccination and the ability to prove that status, you are within that flexibility to do so. And that does not necessarily translate to mandatory vaccination for staff, and I'll get to that bit. And I'll split into two scenarios, and the first one being the new staff members that you might have, and then your existing staff members on the other hand. Now, for new staff, if you wanted to make it mandatory to be vaccinated for your workplace, now that is easier. And the best way to do that would be to introduce in any contracts of employment for any new staff members, whether it be from this influx of skilled migrants, whether it be anyone else as the economy and as the state borders are opened up again, including a clause in your contract which stipulates that they agree and the employee and your prospective employee abides by the COVID-19 vaccination, can demonstrate and prove it, is the best way forward. And putting that in the contract of employment, and you can by all means have those terms in your contracts of employment for new staff, and even mention it in your job advertisements in order to be able to screen that, so it's not coming in the last section after you've done your reference checks or completed the interviews. That's a good way to kind of do a bit of a pre-screen where all your applicants are double vaccinated. So if you're interested in a COVID-19 fully vaccinated workforce, that's something for you to consider. And on our R&CA member resources of our website, there are template contract clauses that you can use for these contracts, which would therefore have COVID-19 vaccination as a requirement. Now, for any existing staff where, they've already signed a contract, before COVID-19 was a thing, it is a little bit more difficult and trickier, and there are a few more things to think about in order to, if you were interested in making the vaccine mandatory for your workplace. Now, the best way, of course, that, I say to members, and we've certainly seen that experience in the other states as a learning experience for yourselves, would be the best way is to obviously just convince your staff without resorting to the legal side of things, where, making mandatory through things like workplace policies is really ideally the last line of defense. If you can communicate it in a way to convince your staff, to allay any concerns and fears, that is the best way forward. Now, I completely appreciate and understand that is not always the case, and everyone has heard a lot about the vaccines and has their own viewpoints and, know quite a bit about all of it. And so it's not necessarily the easiest way to do that. If you wanted to have mandatory vaccines in your workplace, one of the things you can look at is a workplace policy. The workplace policy is obviously something that you probably do have in your contracts, where you've asked employees to abide by all current and future workplace policies. Now, the best way in drafting that workplace policy would be to ensure that you consult with your staff. You do a very comprehensive engagement with your staff members to hear their thoughts about that. And we have on our member resources section as well on our website a template you can use for staff engagement and for the survey as well. And all these factors in play, it all aims to reduce your legal risk. If you wanted to make COVID-19 vaccinations mandatory for your staff, it's all about reducing the risk of, if it came to an employee who refused to get the jab, and as a result, you wanted to terminate them. All of these are just factors. If you're concerned about work health, safety, and liability, and you think COVID-19 vaccination is an important way to do that, can I remind you that there are other factors involved to reduce the risk of COVID-19 transmission in the workplace as well. And these include, the basic things that, we're all very familiar with now, including things like either social distancing or hand sanitizers or masks for staff, your COVID safety plans. All of these are factors, and certainly the inability or the ability to have a mandatory COVID-19 vaccination policy is not the golden, thread or the golden bullet to absolve or to reduce your legal risk and liability. So if you're concerned about transmission in your workplace, I just want to reassure you that it is merely a factor amongst a wide variety that you pick and choose from as well. That is certainly recommended for a more holistic approach to reducing any community transmission of COVID-19. And I'll just end on that point. And if you have any follow-up questions, by all means, as Julia mentioned, the Q&A chat, but also the IR hotline on 1300 722 878. The IR hotline is the best way for a more individualized context based on your particular business and the questions you may have with that. So thank you, Julia.
Brendan, thank you. Just a couple of questions coming through. Kylie Mansfield is interested. You touched on the masks as a preventative for COVID. Her question is, can a hotel reception operator request to see medical exemption documentation for masks in South Australia?
Yeah, certainly where, if a mask is required to be worn and someone is refusing to comply with those compliance measures or public health orders, then a genuine medical exemption can be demonstrated to, whether it be for the vaccine or for the mask, where there is a genuine medical exemption that is permissible. And certainly being able to request to see one would be part and parcel of that.
Thank you, Brendan. No other questions coming through? No, not at this stage.
Oh, there's one more just popped in.
Two more. Okay, let's have a look.
They're coming fast and furious.
Yeah, now they're going to come through. I guess just going back to what Brendan was commenting on there, and going back to the masks, what if the customer refuses to show their exemption?
If someone, refuses to show their exemption and you as a business are doing your best to comply with all these regulations and health orders, you are more than entitled to refuse entry for someone who is non-compliant.
Okay, thank you. And one more, Brendan. If one of the staff contact COVID, rather, what rules will be in place regarding the isolation?
I think
and furthermore,
that one fits under my talk.
All right,
so
thank you, Hugo. I'll leave that one for you.
Yep. All right, well, I'll take it from there if that's where we're going to segue into. But thanks, guys. And I guess my part of the webinar is to really discuss about what happens with COVID and testing. SA has some of the most complicated matrices that I've ever seen in my job, and the other one's actually really easy to follow. But this one's pretty complicated. And the reason it is complicated is because there's no vaccine mandate for hospitality, which means that they have to do two sets of rules, basically telling you what happens if you do get COVID. And what I'm going to do now is I'm going to share my screen, and I'll link these documents in the chat so you can have a look for them yourselves. But these will really help you in understanding what happens if you do have a case, which, knock wood, doesn't happen. But I think it's more than manageable. And it's a really easy response to this, but I'll just bring it up now for you guys. It's a bit of a complicated matrix, but please try and follow it. But I'll link it through to you guys anyway, just so you can follow it in more detail. So basically, you guys can see my screen, right?
Yes, thanks, Brent. Hugo?
Yep. So basically, this is the table which assesses the risk for COVID exposures in general businesses and venues. And you can see here that there are two different charts. For one is COVID, the contact is vaccinated, and one is the contact is unvaccinated. And when you start seeing a lot more greens and yellows, you're looking pretty good. And basically, this table, there's a lot of lines and a lot of figures here, and a lot of numbers, but don't let that get you down, because once you figure out how big your, venue is, how long people are staying there for, how close they are together, it's really easy to figure out if they are a casual contact or not. And this really applies only for the first one in terms of those who are vaccinated fully. For those who are unvaccinated, you can see a lot more reds and yellows at the bottom. And I'll explain what that means in a second. I'm sure you guys have all had a look at it anyway. But basically, if you're a low to casual risk contact, basically you and you're fully vaccinated, you only have to isolate for 7 days unless you prove positive for coronavirus. If you are deemed a close contact to someone who is a positive case and you're fully vaccinated, you only have to get tested on the first day and the last day of 7 days of quarantine. So I'll bring it down here. And this basically tells you exactly what each contact risk actually means. So if you're a low risk casual contact, then you have to do nothing. And that is mainly if you are fully vaccinated. If you are not fully vaccinated, you will never be in that green. You'll never be in that green category. If you're a casual contact, then you have to get tested immediately. You also have to get tested again on the 6th and 13 days, and you have to test until you're negative, basically. So let's say you're deemed a casual contact, then you go home and you get tested. You can come back the next day, basically. That's if South Australian Health deems you to be a casual contact. If you're a vaccinated close contact, you quarantine for 7 days from exposure. And that basically is 2 calendar days after the exposure, because basically that's when they consider you to be most infectious. But if you're alerted immediately by SA Health that you are a contact, then you have to go and test immediately and isolate. But if you prove to be negative on the 6th day, you can basically just return straight to work. The only thing that is required of you is that you have to go into 8 to 14 days afterwards. You have to wear a mask at all times. You have to avoid non-essential activities. You cannot attend COVID management plan events. Now, I'll just say about COVID management plan events, that does not include restaurants and cafes. COVID management plans are like your very, very big events, like the cricket or a festival. And then, basically, you have a bunch of other rules if you if you are deemed a close contact and you're fully vaccinated. If you're unvaccinated and close contact, basically you have the full 14-day quarantine from exposure, and you have to stay in there for the entire full days. Like, you're in hard lockdown if you are a close contact and you're unvaccinated. So really, we can see that it is much more preferable to have your staff and have your patrons as fully vaccinated if they are coming in contact with people who are positive, because you can come back to work straight away, basically. Now, I'll stop the share there, but I'll just say a few other points about that. And I hope that was clear. I know it's a bit iffy, but I hope it was pretty clear. But the question about, will my business have to close for cleaning? You can do that overnight. You only have to close for cleaning if it has to take, if you have to do it during work hours. If you can do it after work and you clean the whole thing up in accordance to SA Health's standards, then you're fine to go ahead. Basically, if you get one staff member who's deemed a close contact, but the rest of them are casual contacts, they can just return straight to work. Like, there's nothing that stops you from doing so. As long as your place is clean, then you can just get new. I mean, it's pretty hard. I know it's pretty hard for me to just say just get new staff, because it's pretty hard at the moment to get new staff at all. But basically, it's not as difficult, and I'll link that in now. But I might actually flip back to Brendan, because I think there's like 2 questions in there that I think that he's best to cover, which is work cover claim and the leave stuff. So I'll link my documents in the chat now. Have a look at it. I'll put my number in there as well, so give me a call whenever you need any clarification.
Thanks, Hugo.
Thank you, Hugo. Yeah, there's a question here on work cover claims. I'm going to presume a little bit here. I take it means if staff contract COVID-19 from another staff member, what happens there? That's certainly something you will have to speak with your workers' comp insurance provider for that as well. But certainly, as a starting point, I mentioned that there are factors that all contribute to any, if there was a claim or any community transmission, that vaccine is one of them, but certainly the other measures in place within your workplace to deal with that are important as well. For the next question, to do with staff quarantining, if they're paid through personal leave or sick leave, so if your staff have been directed to self-isolate in response to a government directive, whether it be because they've contracted themselves personally, whether because they're a close contact of another staff member, whether it's because they're a close contact of someone they bumped into over the weekend, there is an unpaid pandemic leave available in the restaurant industry award of 2 weeks. And that's what they'd be entitled to, unpaid pandemic leave of 2 weeks. Now, if they were personally sick themselves, so let's say they, were sick with COVID-19 or had a cold, flu, whatever it might be, and that's why they were self-isolating. If they were sick, then they would be entitled to personal leave based on sickness. But if they were just directed to self-isolate and were not sick, then unpaid pandemic leave is what they'd be entitled to. And so that's your starting point as well.
Okay. Brendan, there's just a couple there. Paula, hi Paula, how are you? her question is, from 90% vaccinated, South Australia have said that standing drinking will require venues to be fully vaxxed. Is that right?
Yeah, so in the roadmap, yes, those high-risk activities at 90% of 12 plus, high-risk activities only available for people who are fully vaccinated. For example, nightclubs, standing alcohol consumption. So that's what the roadmap says. It will depend on what's actually in the public health order.
It'll also depend on when. I'll also just preface that by saying it also depends on when they get to that point as well. I mean, 90% 12 plus has no date whatsoever at the moment, so it could take a while. It could be in the next 2 weeks.
Also, as far as the work cover question, New South Wales is the only state that I know of that has presumptive work cover for COVID-19, meaning in New South Wales, it's presumed that you got COVID at work automatically, and that law is likely going to be repealed. But in South Australia, I don't believe it's presumptive, which means that it would be a standard workers' comp claim. If an employee believed they got COVID at work, then you would go through that process. But you need to check each individual circumstance, as Brendan said, with your workers' comp provider.
There's a question from Sandra in the chat. So to clarify casual and close contact, basically, you're more likely to be a casual contact if you're vaccinated than you are unvaccinated. But the difference is that the casual contact is basically if you spent less than 1 minute, less than 1.5 meters away from that person. So you're not too close to them. So they'll probably be your back of house people. Your front of house are more likely to have that vaccinated close contact or low risk casual contact. Casual contact, and that requires like mask wearing, or you're just like a waiter and you've just put down the food and you've walked off again. It's when you're not spending too much time face to face. And basically, I'll just also want to say that SA Health will tell you that you've had a case in the premises, and then it's your job to tell your staff that they may be at risk. But basically, this is why the QR code stuff is so important, because it helps keeps track of all this stuff, and it saves you a lot of headache having to figure out who came into your restaurant.
Thanks, Hugo. Just a couple there. Just now that you've mentioned SA Health, is it the responsibility of SA Health or the owner of the business to clean their restaurant or venue?
That'd be the responsibility of the business.
From my that's right.
So ultimately, as we started this webinar talking about vaccine mandates, I've spoken directly to the Premier of South Australia, who at present has said that South Australia is not going to be mandating vaccinations. It certainly makes things a bit more difficult for many businesses because you do have Safe Work Australia obligations and you have Safe Work South Australia obligations. You certainly need to ensure the safety of your workforce and your patrons in many cases. So it is very important that you as a business, in determining whether or not you mandate the vaccination, are taking advice from professionals and from your association. Certainly, once the borders open, and there will likely be community transmission, then certainly some of the things that Brendan said around mandating the vaccination and your employees will be triggered in terms of the Fair Work Ombudsman and a Tier 3 status, which is one of their 4 tiers related to whether or not you can mandate the vaccination for your employees. And one of the tenets of that, one of the foundation stones, is that there's community transmission in your area. And certainly in the East Coast states like New South Wales, Victoria, ACT, while there remains community transmission, many businesses in those jurisdictions had already stated that they were going to potentially mandate the vaccination before it became mandatory in those areas anyway. So certainly, you should not think that you will get in any trouble. It is not discriminatory, as Brendan said. So privacy does not apply to mandatory vaccinations. Discrimination does not apply to mandatory vaccinations. And certainly no shirt, no shoes, no service as a private business does not apply to mandatory vaccinations. Certainly your staff, it will be important to follow all the Fair Work Australia and the Fair Work Ombudsman's rules, which Brendan or Hugo can provide to you. Those were emailed out previously in the states that had active communication, active transmission and community transmission. So we certainly can provide those to you as the borders reopen and cases are likely to pop up throughout South Australia.
Thank you, Wes. Guys, are you happy just for me to field a couple more of these questions that are coming through?
Yep, absolutely.
All righty. Hugo, this may be one for yourself. Ben's asking, as a vaccinated close contact, it states a 6-day negative test is required for that a staff member. Oh, it's just gone. It's just dropped out on me. He just wanted some clarification. It's just dropped out on me.
Brendan answered it, that's why. So if they're sick, they would have
I beg your pardon.
If they're not sick, there's 2 weeks of unpaid pandemic leave.
Yeah.
So that's the answer.
And there's another one in there
thank
for
you.
there's another one in there for Brendan as well. I don't know if you answered that one, mate. About
Can legal action be taken against a business from an employee who contracts the virus from a guest or staff member?
Yeah, certainly for that question, look, we're certainly heading towards an environment in a future, and as Wes alluded to in New South Wales, where it is going to be treated like the flu. And so if a staff member contracts the flu from a guest or another staff member, I think that is a good example on where this is heading towards and the direction we are heading towards. And so there might be some people who think that in the early stages there's a potential case for this or potential legal precedent. But I think we're certainly seeing with all the different state governments, the approach that they're trying to take and the rebalancing of liability is certainly towards a direction where it is going to be treated like the flu, and therefore, appropriately, just like you would not be, going to be sued for someone who contracts the flu at the workplace. And this is the environment in which we will be operating in as well.
Thank you, Brendan. I think we've definitely covered some of those questions. Anybody that's asking if this information, if they can get this information, is most definitely this has been recorded. So you'll be able to find this webinar on our website. So you just log in and across the top under membership, just drop down and you'll see the podcasts and webinars that are available to you straight away. So yes.
So there is a question up about what payments, I'll add the word, it's not there, what payments are available to casual staff who are directed to stay at home, obviously not on a roster. So what would be available to a casual staff that has no sick leave and no direct funding from the business? Does there remain any state or federal funding for a casual staff member who is directed to stay at home as a close contact and test?
Thank you, Ed.
Brendan, Hugo, do we have an answer?
I take that on notice. I don't believe there is anything at the moment. There's no
So-
payments the government's been going out with, but I can get back to you.
So there was a federal disaster relief fund payable to individuals that are in an area that is closed down, locked down, and considered a hotspot. And there was made available in other states and territories funds from the state government. So depending upon how many community transmissions there are and how many close contacts and people who are required to isolate would depend upon whether the state enacts any of those payments. But because South Australia is, for all practical purposes, well open, those particular payments are not in place because there's no community transmission. So we'd have to wait until that happens to see what the state affects.
Yeah, and look, there were previously ones that the SA government was rolling out, but that was really when they started designating hotspots, and when they had that cluster moments, and they were giving about $330 a week for those people who were isolating because of that. Haven't had any announcement as if to whether they will continue that. They haven't said anything about whether they will consider things clusters or not. So we'll have to just see. Basically, if the SA government does make any further announcements, what happens if you are actually in like a designated hotspot or something. But yeah, no announcement at the moment. What happens for casuals?
So Kristen Whitaker has a very long and good question. If someone has an exemption for wearing a mask, and they've proven to you that they have a medical exemption for wearing a mask, are we discriminating against them by requesting that we serve them outside? So just like fully vaxxed definition is fully vaxxed or medical exemption, the same definition would likely apply for a mask. So it's either wear a mask or have a medical exemption. So you would treat that person the same as if they had a mask on, because they have a medical exemption. So you shouldn't you shouldn't try to serve them outside. And certainly there is signage available, both from Restaurant and Catering, the South Australian government and the federal government about masks and exemptions. And so if you have any other customers that are uncomfortable, you can certainly say that exemptions are allowed if they're proven. So it is important to maintain your business, but certainly if someone has a real and provable medical exemption, that you treat them the same as someone who is masked.
Thank you, Wes.
So we're happy to answer any questions, or we're happy to wind up. We're coming close to the end of the webinar, yes. Hugo has put his phone number in the chat. He's a brave man to put his mobile phone number there, and Brendan has called out the hotline, and he will call it out again for those of you who would like to write it down. It is.
That's right. It's 1300-722-878. That's 1300-722-878.
Awesome. And for anyone who wants a copy of the matrix that was published, Hugo's email is also in there. If you want to shoot him an email, he can send you a hard copy if you weren't able to download it from the chat function. And this is a question for you, Hugo. It's, if a front of house person is deemed a close contact, will the entire team, front and back of house, be deemed a close contact because they all continue to work together until South Australia alerts the restaurant?
Basically, you'll have to make that based on your judgment of whether they've spent close time and close proximity with each other. If you have a venue which has two different wings or two different parts of the building, then I'd say no, but you'll probably have to base that on the judgment of the matrix that I've put into the chat. But if it's staff, I mean, I think if you're a smaller venue, then it's most probably going to be the case that they will be close contacts together, especially if they themselves, one of them has COVID themselves. If it's like a staff, if it's a patron that's come in and they've barely spent any time with them, then it's the likelihood of all of them being close contacts reduces. So there's only 3 ways that your business can be shut down during this time. It's whether the cleaning has to take place during work hours because you can't do it, whether you can't actually you can't actually get enough staff to work in there, or SA Health deems it to be so bad in there that they shut you down, basically. So, if you do have staff that weren't there and they're not close contacts, or you don't deem them to be close contacts, and SA government's fine with that categorization that you've made, then they're all good to go. I think I should also just say that point is that you have to make the assessment yourself based on those tables, and then you have to inform SA Health, and they'll come back to you and give you the tick.
Also, RE masks. I don't know if you can see it, but if you want to go to the covid-19sa.gov.au. That's covid-19.sa.gov.au. And just type in the word masks into search. It clearly says a requirement that a person wear a face mask does not apply to a person if they have a relevant medical condition, and evidence of that relevant medical condition must be produced on request. So that is coming directly from the South Australian government. I've sent that link to Hugo and Brendan. Hugo, if you want to get that into the chat, and I know I texted it to you, but if you can hop on your computer and put that in the chat, that way everyone's comfortable and you can print that out and show it if you need to. Cody, again, South Australia has no community transmission. And so there has been no funding that has been allocated yet because no one knows if there's going to be any community transmission. And so only if that becomes a problem would the state government step in and put in place stimulus. So for example, New South Wales, Victoria, and then the ACT, right? ACT did not have any state or territory stimulus in place until they had community transmission. Victoria did not have any stimulus in place until they had community transmission from New South Wales. So it happens after, it doesn't happen before. The state would never announce we're going to pay businesses money in case something might happen. They typically react instead of pre-announce. All right, so we are coming. Go ahead.
No, thank you, Wes. Yeah.
So we've got about 15 more minutes. Certainly happy to continue answering questions. They are coming in fast and furious. I will, Julia, if you want to read out those questions, and I think both of those are for Hugo.
Just going down to them now, Wes.
That's right.
Was it the legal action can be taken against a business?
No, these are in the open questions.
Open ones. It's all right. For masks for chefs,
Okay,
it's basically whatever the rules are right now. None of the restrictions about density or masks change at the moment. It's just basically the isolation at the moment, because basically COVID's going to be coming to South Australia. We'll see how bad it goes. Is it our obligation to refuse any entry to anyone who will not fill the contact tracing form with the QR codes? That would have to be your policy, but basically, yeah, QR codes will have to be adhered to. And as I said, I would highly recommend that you do it, because not only is it illegal to not do so, but also, as I said, with the isolation, it really, really, really saves you the headache of having to figure out who was in your venue at that time.
Also, normally what happens with public health orders, so South Australia has not had to deal with these type of public health orders in so long in relation to community transmission of Delta, like New South Wales and Victoria. We have gone through so many questions and so many iterations of public health orders in relation to things. And so we do expect that that the rules will be written and codified with more specific information as we get to tomorrow. We don't expect there to be anything because it's just borders. But as we get to that 90%, in order for the state government to actually enforce things like high-risk activities only for vaccinated people, okay, if the government in South Australia says that you can only be in a nightclub or you can only stand and drink if you're vaccinated, well, that's the business that actually has to ensure that that happens. It isn't going to be, a South Australia council worker who's responsible for local council health rules that's standing at the dance floor of your business to ensure that no one's dancing or no one's standing up. And I know that South Australia hasn't had to do this, But in order to go from where we are today or tomorrow with the borders open to 90% 12 plus, many of the things that were announced in the roadmap, they do require a little bit of business enforcement. And while that will sound like a shock to many businesses, about 70% of the entire hospitality market on the East Coast has been complying with and has been enforcing public health orders with very little trouble. It certainly is something that's scary, and it's certainly something that you think your customers are going to blow up in your face. And there will be a few of those instances, but overwhelmingly, customers and hospitality businesses just want the businesses to be COVID safe, because no one really wants to get COVID. And so besides a few outliers, we've seen almost no problems within businesses. Yes, there have been some protests and some marches that are related to things like mandates and other things, but not individual businesses. No one is singling out individual businesses for enforcing public health orders or rules that are put in place. And yes, similar to an earlier question, yes, if the government is going to require high-risk activities to be for only fully vaccinated, there'll have to be some mechanism to enforce that, and it will likely be things like QR codes or entry requirements to certain type of businesses. So it's stay tuned. We don't know exactly what that form will be, but it certainly will be under the Biosecurities Act and the state of emergency that South Australia is in. The entire country is still in a state of emergency. We remain in a state of emergency. We will likely remain in a state of emergency throughout most of 2022, which will allow the government to continue to ensure the third jab, which will likely change the definition of fully vaccinated. It will continue to allow certain settings to require vaccine mandates, like airports and other settings that can only be done when there is a state of emergency or a state of a pandemic called. So, we're going to be on this journey for a bit longer, but there are lots of green shoots. The borders reopening, state borders reopening, international students, working holiday makers, and skilled migrants coming back. Soon it will be tourists. We certainly will be welcoming everyone back into South Australia. And we're here to answer any of your questions. And no question is bad. There are no bad questions. Certainly we will, if we don't have the answers, we can get the answers immediately. There'll be some questions we don't have an answer to yet, like the stimulus, because South Australia hasn't announced any stimulus yet, because it's there is no community transmission yet. So this is back to you, Hugo. Are you legally allowed to ask to see your employees test on day 1, 6, and 13? And if they refuse to show it to you, where do you stand?
You'll have to talk to SA Health. Basically, it'd be pretty crappy of your employees not to tell you. And I don't know, it'd be hard to see where you stand with that. But SA Health will be in touch with you and tell you basically where everything's at with your staff, if they should get the need to get tested. So if I were you, I would contact SA Health if they refuse to tell you. But I think, quite frankly, just a polite conversation with your staff to say, hey, how'd you go with the test is there. And if they don't tell you, I'd really question how bad your rapport is with your staff.
Ultimately, it's your responsibility as an employer to ensure that there is no one in your business that is positive. So that certainly passes the reasonable test to determine whether or not they have a positive COVID test. Just remember back to when SA Health told you that an employee or a patron was positive. They would have to tell you which employee. They would have to tell you, you were chasing down in customer lists, and they were asking you where people sat in your businesses. So I know it's easy to forget. We've in South Australia, we've lived with no community transmission for so long. We have to get our minds set back into, okay, the borders are opening, people will be able to travel freely, so there will likely be community transmission again. Hopefully not, likely there will be. Let me put my hat back on to what I did when there was community transmission in place and what was allowed and what wasn't allowed. Certainly the same type of things remain allowed and not allowed going forward. For example, on the East Coast, well, really in almost every other state and territory, it's a tenet of proving your positive or negative or your vaccine status to almost do anything. So, I wouldn't be as afraid that asking your staff will be breaking the law if they attend your business positive. So it will be worse for them than it is for you. So it is very important that you're getting that information to ensure that the matrix is followed and that that they're not purposefully infecting other people. So if there are no more questions, it looks like we are all done. And we just check the chat. Beautiful. Hugo has gotten the mask words, and certainly print that out and have that ready to show to staff and patrons about mask exemptions. That's coming straight from SA Health, and can't really be refuted. I know guide dogs were a bit of an odd one. There were some patrons out there that tested the system by bringing their service dog or their guide dog in and refusing to show you the certification of their guide dog, and then trying to affect your business because you didn't let them in or you requested to see their documentation. COVID's a bit different. We're in a state of pandemic and a state of emergency. Certainly your reasonableness of protecting your employees and your other patrons far outweighs the individual not wanting to show you a medical exemption for masks. So we got a couple more questions. Yes, you have a duty of care to see exemptions. You have a right to. You have a right to. You need to see their exemption because ultimately, if they're unmasked and they don't have an exemption and they're COVID positive, they would create a close and contact and high risk situation in your business. All right, so
Yes.
I'm going to thank Julia for organizing this webinar, and Brendan and Hugo once again for presenting amazingly and answering very tough questions, very relevant questions, and always thanking KK for setting up the webinars and keeping us digitally connected and certainly doing a lot of behind the scenes work that we are very grateful for, and the entire restaurant and catering team. If you have any other questions, you can certainly email or call Hugo and Brendan on the hotline. And you're always welcome to go to Julia with emailed list of questions, and she can forward those on to the relevant departments if they're outside of COVID. But for those of you who may be on the link that aren't members of Restaurant and Catering, certainly give Julia a call. There is no better time to become a member of Restaurant and Catering than now. And certainly you'll be surprised. It is very reasonable and you get a lot for your membership. I think the total is up to nearly $50,000 in potential savings by becoming a member from suppliers and in added value that you get from departments like Brendan's and Hugo's. So certainly reach out to Julia, and we thank you all for joining us today.
Thank you, everybody. Have a good one.